Hi, my name is Colton King, and my senior project of interest is on hypoplastic left heart syndrome, also known as HLHS, and I chose this because my nephew Landon has it, and he's had it for most of his youth years. I think he's been going through surgeries till he was about 4. And about it, it's mainly just an underdevelopment of the left ventricle aorta and aortic arch, as well as the mitral atresia or stenosis. And here you have a picture of a normal heart and what a heart looks like with the syndrome. And the main parts that you can really tell the difference is with this patent ductus atriosus. It's a lot smaller and skinnier and almost closed off compared to a normal one. And the left ventricle is about 1/3 the size of a normal ventricle in a normal heart. And this diagnosis only happens about 0.02% of live births. And prevalence prenatal diagnosis early in pregnancy. With this, it will help the parents and the doctors and everyone really get prepared for the birth and get surgeons and everything that they need ready for when they need to really go into surgery. And this is Landon is probably getting the most graphic picture out of this whole presentation. Majority of the cases, they won't realize or have any symptoms of their baby having HLHS, and the sensitivity with it varies with who they have, the doctor that they have taking the ultrasound, and the types of views they can get of where they're getting the ultrasound and where the baby is placed or setting when they get the pictures. And detection rates can vary between 7 to 95%. And as I was stating before, getting prenatal diagnosis can help with medical and surgical management, so they can have surgeons and doctors on standby as the woman is giving birth to the baby if they know that their baby is going to have HLHS, so they can put them straight into surgery and try and get it fixed. And with the prenatal diagnosis, so they get it diagnosed early in the pregnancy, can help ready the parents and the doctors for what can happen later on if things don't go where it's supposed to go. And most of the time, if a woman will find out that their baby is going to have HLHS, they will end up terminating the pregnancy. There's 3 stages of the heart surgery, which is Norwood, Glenn, and Fontaine. Norwood, the atrial is cut, and then the proximal pulmonary artery is connected to the hypoplastic aortic arch. And aortopulmonary shunt is created to connect the aorta to the main pulmonary artery to provide pulmonary blood flow. Glenn was performed about 6 months after the Norwood, and Landon had the Norwood surgery when he was about 6 weeks old. So in this one, he's about 7 to 8 months old. And the Glenn is superior vena cava is joined to the right pulmonary artery, so the blood goes around the deformed right chambers of the heart and is shunted directly into the lungs to be oxygenated. Fontaine happened about 18 to 36 months after the Glenn surgery, and the Fontaine can connect the inferior vena cava to the pulmonary artery by creating a channel through or just outside the heart to direct blood to the pulmonary artery. All deoxygenated blood flows passively through the lungs. Some facts about this is there were 79 fetuses diagnosed with HLHS in Birmingham, England between 2000 and 2004. And 25% of the parents decide to terminate the pregnancy, and 10% of the babies are born still and not moving. 25% of compassionate care, 15% died before surgery, and 50% of them had surgery, and Landon was one of the 2/3 of babies who had surgery and survived. And neurodevelopmental outcomes, 7 out of 11 survivors with major developmental disabilities. Landon was not one of these ones. Median IQ 66, 50% of the babies born with HLHS had cerebral palsy. Median IQ 86, 18% with mental retardation, 33% in special education. 3 out of 31 survivors have significant neurologic impairment, and Landon was lucky again to not be one of these. Other accommodations is due to Landon spending most of his early life on his back, he had to get a helmet to help form his skull to the right shape, and his bones were also very brittle, and that's where the walker and the sling came in, is so he can learn to walk. He wasn't able to start walking until he was about 4. Started able to start walking or playing or being a kid. And that is the end of the presentation.